I'm Dr. Tanveer Janjua. I'm a board certified facial plastic surgeon, and today I will be demonstrating the journey of an otoplasty for a 15-year-old patient. We would see her before surgery, immediately after, and then the next day, and then maybe a week later to see how she progresses. And hopefully this video will help individuals who are contemplating having otoplasty plan their process and their recovery as well. Today we are starting our journey of otoplasty with our patient, and we want to demonstrate how it proceeds. As you can see in our patient, the ears are protruding outwards and there's protrusion on both sides. And also, if we were to look closely, we do not have a very good helix, anti-helix. We have the helical fold, but we do not have a good anti-helical fold, which should appear a little bit like this. So we want to reconstruct that, and also to push back the ear to a good angle of about between 15 to 20 degrees. Right now it is way more than that. And the same thing on this side, where we do not have a good anti-helical fold, and we want to create that. And the conchal bowl is very deep, so we want to push it back as well. And we will follow our patient immediately after surgery, and then next day, and then maybe in a week's time. At this point, we have finished the surgery of otoplasty on our patient, and she's doing very well. We'll take a quick look with the video and see how she feels and how the ears look. Could you please tell us, how do you feel?
I feel good.
Okay, how was the surgery?
Easy.
Okay, did you sleep through it?
Yeah, most of it.
Okay, did you have any pain?
A little bit, but
Not much, okay. And how do you feel right now?
I feel good.
Any pain right now?
A little bit.
A little bit, okay.
Yeah.
On a scale of 1 to 10, how would you say, 1 being the least pain, 10 being the most, where would you put your pain?
3.
3, okay. Great, very good, excellent. So I'm going to just take a quick turn here, just to see this side. Very good. Great. I'll turn you around the other way. Look on this side as well. Very good. Let's get your lovely hair out of the way. Perfect. Great. Thank you. We'll go ahead and we'll put some dressing on you for now. How do you feel with the dressing?
Good.
Not too tight?
No.
Great, very good. Hi, good morning. We are on post-op day 1 after doing otoplasty on our patient, and we want to find out how our patient did last night and today, and if she has any concerns, and what to expect for future patients who might be watching this video. And it's very important to know how to handle the first night and any care involved. Usually there's no care after otoplasty for the first night because you're all wrapped up and all you have to do is just keep yourself comfortable. So how was your night last night?
Good. I didn't have any problem sleeping. I just kind of slept on my back and I did fine.
You did fine? Okay,
Yeah.
got you. Was the pain controllable? Were you able to minimize the pain with the Vicodin?
Yes, it was smaller. It's still there, but it was less pain.
It was less pain, okay,
Yeah.
got you. Anything you can advise other patients who might go through it in terms of how was your experience with surgery yesterday? Was it...
I was awake most of it, but I didn't really feel anything, so
Okay, great, great.
it's fine.
Any other advice for afterwards for the first night for patients?
I don't know, it was...
Just chill out and relax,
Yeah,
right?
just don't...
There was nothing much to do.
Yeah,
Were you
there's-
able to eat?
Yeah.
Oh, okay, gotcha. Did you throw up, any nausea, vomiting?
I was feeling a little sick, but
Mhm.
it wasn't... I just stopped. I just drank a lot of water and
Okay,
it was fine.
okay, got it, great. And how do you feel today?
Today I woke up a lot better than yesterday.
Very good,
Yeah.
great. Have you had a chance to look at your ears?
Yeah.
What do you think?
I like them.
Good,
Yeah.
good, excellent. You do have a lot of swelling. It takes a little while for it to go down before you can see the final result.
Okay.
So I'm just going to turn you a little this way. Great. And I'll turn you on the other side as well a little bit more. Perfect. So in terms of the care, what you have to do is we'll put a lighter dressing on today.
Okay.
And then starting this afternoon, I want you to take a cotton ball and hydrogen peroxide, dip it in there, and just go behind the ear.
Okay.
And when you're doing it, don't try to push the ear forward.
Okay.
Because as you know, the stitches, we don't want them to break. So just clean in the back. And once you feel like you've gotten rid of any dried blood or anything and clean it well, then take a dry gauze, so just gently dab it. Then you take the bacitracin or the neosporin and put a good amount behind it.
Okay.
And after that, you can put the dressing back on. The
Okay.
dressing that will give you the Velcro dressing.
Okay.
And in terms of showering, we don't like to shower for the first 2 days. After that you can, which means tomorrow morning you can shower, that's no problem.
Okay.
And when you do the shower, water can run right through it, no problem. Just don't scrub it very hard.
Okay.
Just be gentle with it.
Yeah.
And every time you put the dressing on, remember the ears can be numb after surgery. So you want to look in the mirror when you're putting your dressing on to make sure that the ears are flipped back and not forward.
Yeah.
That's what you have to be careful.
Okay.
And I think that's the only thing. And otherwise, now from this point onwards, everything is very easy. You're out of the woods for anything serious happening at all.
Okay. All right.
And make sure you finish the antibiotic that we gave you.
Yeah.
Great. And if you run out of any pain medication, let us know.
Okay. Yeah.
Okay?
Okay.
Great. So we'll see you again at the end of the week, before the weekend, just to make sure that everything is good. And that'll be just a quick look. And after that, we'll see you the following week.
All right.
Okay? No soccer as yet.
Yeah, no soccer.
And no karate either. Okay, very good. So today we are at post-op day number 6 after otoplasty on our patient, and she has done pretty well, and we would like to hear how the last week or 6 days have been. Could you please tell us how you've done over the last 6 days?
I've been doing good. I've been unwrapping it. My aunt has been cleaning it because my mom can't do that type of stuff. And I've got, the pain was minimal. I would take the Vicodin and it was good. Today I stopped taking the pain medication because it barely hurts anymore. And I don't know, it's been good. Sleeping has been kind of hard because I usually sleep on my side, but I've been able to manage.
Okay. And what kind of activities have you been able to do? Because people like to know what can I do afterwards in the first week.
I don't know. I haven't really tried anything. Soccer hasn't started yet. So.
Okay. How about were you able to do computer, emails?
Yeah, I can do all
Okay.
the basic daily activities.
Not an issue.
No.
How was showering? Showers were okay?
Showering, washing my hair was a little difficult, but taking a bath was nice.
That was okay?
Yeah.
Great, very good. Would you mind turning a little to the side so we can focus right there? Great. Excellent. Now we'll have you turn to the other side, please. Excellent. So we are 2 weeks after otoplasty on our patient, and she has done very well, and she seems to be happy, and I think she's pretty excited. But I want to know how the last week of recovery was and how she's been feeling.
It's been pretty easy, no pain virtually anywhere. When I sleep, I feel. When I'm trying to sleep in my ear, I feel like a little bit of pain, but it's really not a problem.
Okay. Was there anything different than what you expected before surgery in terms of the healing process? Any surprises or anything?
No, I pretty much did my research before, so I knew it was coming.
Gotcha. And any advice you would give to someone who might want to do this surgery, and any tips as a patient?
I mean, at first it does hurt quite a lot, but the pain does go away.
It does?
Yeah.
And the medication helps?
Yeah, the medication helps.
Great, very good. That sounds good. Excellent. Any questions?
Yeah, when can I start cleaning it? Because I know it's 2 weeks today.
I would do like 1 more week.
Okay.
It looks pretty good in the back right now. And actually, let's show the camera as well. I'll turn you around so we can see in the back. And it looks pretty good right now in the back, actually. So there's no drainage, there's no scarring that you can see. Everything is pretty good. and you've done a good job keeping it nice and clean. You can turn around now. So I would do one more week just to make sure that you have no accumulation of normal stuff in there.
Yeah.
Infection is not a concern this time, but what happens is that this keeps catching a little bit of like the oil, and it accumulates and becomes a little yucky in there.
Yeah.
And so just one more week of cleaning, only once a day. That's it.
Yeah.
Just once a day, and then afterwards, always remember for the next month or two, like when you're taking a shower, to just gently run your fingers over there in the groove in the back to make sure there's nothing in there.
Okay.
But that's all you have to do, nothing else.
Okay, and soccer.
Aha, soccer. So you can start playing soccer in a week from now.
Okay.
You can play that, but can you have a headband on when you play?
I'll see about. Yeah, I think I can. It has to be like a soft headband.
Well, yeah, soft headband, anything, just something, because my only concern is like if you get tackled and somebody pushes the ear forward. That's the only thing.
Yeah, it's only like tryouts right now.
Right. So for the tryouts, if you can just have the band on, that's great. But even if not, I'm not too concerned.
Okay.
Yeah, but if you can wear that, would be very helpful. So one more week, and you can do it.
Okay, because I'm not really concerned about it because I'm technically on the team already.
Yeah, but no, I just want to make sure that
it
you
starts
do a
this
good job.
week.
That's fine. That's no problem.
Yeah,
And can you hold off on the karate? I know you do karate as well.
I'm starting karate in September, right?
Oh, perfect. By that time, you can do whatever you want. Excellent. Good. Can I see you in a month?
Yeah.
Great. Please ask Mom if Mom has any questions. Or no?
Do you have any questions?
Yep.
Si vos te quieres ir a los parques, puedes subirnos ride.
Oh yeah, if I want to go to Six Flags.
Six Flags?
Roller
Yes.
coasters?
Absolutely.
Okay.
Absolutely.
Because the wind. Maybe.
Yeah, no problem. You can
Alright.
go to roller coasters. You can go to water parks as well.
Okay, nice. Thank you.
Great. You're very welcome.